Now we will be discussing about the mitochondrial diseases. These are rare disorders arising secondary to failure in the oxidative phosphorylation. So these diseases, mitochondrial diseases, they arise from after the failure of oxidative phosphorylation. It is the energy generating process that takes place in the mitochondria, tissues with high energy requirements. So in our body, some tissues they require more energy, like central nervous system, brain and spinal cord, and skeletal muscles. These these are preferentially affected by mitochondrial diseases. So there are two types of mitochondrial diseases: mitochondrial myopathies and Leber hereditary optic neuropathy. So mitochondrial myopathies, these include MELAS or mitochondrial encephalomyopathy with lactic acidosis and stroke-like episodes, and MRF, myoclonic epilepsy with ragged red fibers. These ragged red fibers are present in the muscles. Light microscopy with stain ragged red fibers due to compensatory proliferation of mitochondria, and with electron microscopy, mitochondrial crystalline inclusions are seen. Leber hereditary optic neuropathy. When mutations in the complex 1 of ETC take place, then neuronal death in the retina and optic nerve takes place. It leads to subacute bilateral vision loss in teens and young adults. Males are more affected than the females. It is usually permanent. Leber hereditary optic neuropathy is permanent. It is maybe accompanied by neurologic dysfunction. So one side effect is it is vision loss, and other is neurologic dysfunction by Leber hereditary optic neuropathy. So neurologic dysfunctions include tremors, multiple sclerosis like illness. So these are mitochondrial diseases. Now we will discuss about the Rett syndrome. Rett syndrome, it is sporadic disorder. It is not genetically transferred to, or it is not transferred by the parents. It is caused by de novo mutation of MECP2 on X chromosome. So MECP2 is located on the X chromosome. It is seen mostly in females. Rett syndrome is mostly present in the females. It is embryonically lethal in the males. Individuals with Rett syndrome experience initial normal development. Normal development takes place from 6 to 18 months in the Rett syndrome. After that, it regresses, like regression in motor, verbal, and cognitive abilities, like ataxia, seizures, scoliosis, and stereotypic hand wringing. So these are main symptoms of the Rett syndrome: ataxia, seizures, scoliosis, abnormal curvature of the scoliosis is abnormal curvature of our backbone, and stereotypic hand wringing. Stereotypic hand wringing is basically pushing hand to the backside or in the abnormal position. It mostly happen in the Rett syndrome. So how can NBME ask some question from Rett syndrome? So they can ask, a 13-month-old baby present to you with normal development from first 12 months, and after that she has declined her motor, verbal, and cognitive abilities, or she has seizures, ataxia, or scoliosis, and some abnormal movement of hand or stereotypic hand wringing. So it is Rett syndrome. It is due to mutation on the X chromosome on gene MECP2. So we have discussed about the Rett syndrome. Now we will discuss about the Fragile X syndrome. It is X-linked atypical inheritance. Its meaning is it is atypical, like trinucleotide repeat expansion (CGG). It occurs more rapidly in the next upcoming generation. Trinucleotide repeat in FMR1 gene. Hypermethylation of cytosine residues. Because of this decreased expression, it leads to decreased expression, hypermethylation. It is most common inherited cause of intellectual disability. Down syndrome is most common genetic cause, and it is most common inherited cause of intellectual disability. So Fragile X syndrome and Down syndrome, they both cause inherited. They both cause intellectual disability. But some cases occur sporadically. Sporadically, it is not genetic or it is not inherited. It is caused by some random changes. Trinucleotide repeat expansion of CGG. So these are trinucleotide. It occurs during the oogenesis. There are two types: pre-mutation, 50 to 200 repeats of these CGG, and full mutation, more than 200 repeats. So when there are more repeats, it causes more serious side effects. So 50 to 200 repeat, it causes tremor, ataxia. There is ataxia is imbalance in the working, and primary ovarian insufficiency. It is caused because of pre-mutation of 50 to 200 repeats. Full mutation, more than 200 repeats. It leads to post-pubertal macroorchidism or enlarged testes, long face, very large jaw, large everted ears, autism, mitral valve prolapse, hypermobile joints. So self-mutilation is self-harm or harming one itself. It is common and can be confused with Lesch-Nyhan syndrome, because self-mutilation is very common in the Lesch-Nyhan syndrome, and it is also common in the Fragile X syndrome. So these are similarities between Lesch-Nyhan syndrome and Fragile X syndrome. So full mutation is more than 200 repeats of these CGG trinucleotide repeats, and pre-mutation is 50 to 200 repeats. Now we will be discussing about the trinucleotide repeat expansion diseases. They may show genetic anticipation, disease severity increases, and age of onset decreases in successive generations. So age of onset and disease severity increases because of genetic anticipation. These trinucleotide are repeated more in the successive generations with more number. So now we will discuss about some diseases. Huntington disease. Its trinucleotide repeat is CAG, and its mode of inheritance is autosomal dominant. Huntington disease, CAG, autosomal dominant. Myotonic dystrophy. Its trinucleotide is CTG. We can remember like CT. And its myotonic dystrophy is also autosomal dominant. Fragile X syndrome. Its trinucleotide repeat is CGG, and Fragile X is X-linked dominant. Friedreich ataxia. Its trinucleotide repeat is GAA, and its mode of inheritance is autosomal recessive. So Huntington disease and myotonic dystrophy, these are autosomal dominant. Fragile X is X-linked dominant. Its name is X Fragile X, so its meaning is it is X-linked dominant. And Friedreich ataxia, it's autosomal recessive. So how can we remember Friedreich ataxia? It is autosomal recessive. So FRI for Friday. Friday is day of the week, and it automatically comes at its exact number. So Friedreich ataxia is autosomal recessive, and its trinucleotide repeat is GAA.